Welcome to this explainer. If you've been struggling to figure out how simply changing when you eat, or, get this, how you breathe actually impacts your metabolism, well, you are absolutely in the right place. Today, we're demystifying insulin resistance. But more importantly, we're building a science-backed, entirely natural action plan to help you manage your blood sugar. We're going to look at the remarkable ways our bodies process energy and exactly how we can optimize those systems. So, can breathing and cold potatoes actually fight diabetes? It sounds totally absurd at first, right? Cold potatoes and taking a deep breath? Kind of sounds like a weird spa day. But the data actually shows us that these entirely natural interventions can fundamentally change your metabolic health. We are talking about genuine cellular-level changes that help manage prediabetes and diabetes completely independent of medication. It's truly fascinating.
All right, here is our roadmap for today. We'll quickly cover the insulin resistance problem, dive into the power of resistant starch, look at exercise and intermittent fasting, explore breathing for blood sugar, and then finish up with your daily action plan.
Section 1. The insulin resistance problem, and understanding this cellular blockade. To really wrap our heads around insulin resistance, just think of insulin as a key, and your cell as a door. When you eat, glucose enters your bloodstream, and your pancreas releases insulin to unlock those cellular doors so the glucose can get inside and be used for energy. But in a state of insulin resistance, it's like the lock gets rusty. The key just won't turn. As a result, glucose builds up in the blood. The body panics, thinking, hey, there aren't enough keys. So the pancreas pumps out even more insulin, creating this state of hyperinsulinemia. And over time, this chronic high blood sugar drives oxidative tissue damage, actively pushing the body toward type 2 diabetes and cardiovascular disease. Now think of stress and inflammation like a stuck accelerator pedal in your brain. It actively worsens our glycemic control. When we're chronically stressed, our bodies live in a state of glutamate dominance. That's an excitatory neurotransmitter that just overstimulates the nervous system. This signals the HPA axis, your body's stress response system, to flood your system with cortisol. And cortisol intentionally raises your blood sugar by forcing the liver to dump stored glucose while simultaneously reducing how much of that glucose your muscles can actually absorb. So stress is literally keeping that cellular door slammed shut. Moving right along to Section 2, the power of resistant starch and the gut-glucose connection. Look, we all know by now that not all carbs are created equal. Rapidly digestible starches, think white bread or hot refined grains, they break down instantly in the small intestine. They hit your bloodstream like a freight train, demanding massive amounts of insulin. But resistant starch does exactly what the name implies. It resists digestion. It completely bypasses the endogenous enzymes in your small intestine and travels intact straight to your colon. By substituting those rapidly digestible starches for resistant ones, we effectively lower the glycemic load of our meals and prevent those dangerous glucose and insulin spikes in the first place. Okay, so there's a really crucial distinction here between type 1 and type 2 resistant starches. RS1 is physically inaccessible starch, because the starch is literally trapped inside intact plant cell walls, like what you'd find in whole lentils or beans. Your digestive enzymes just cannot reach it. This dramatically slows digestion. RS2, on the other hand, is found in foods like unripe bananas and raw or cooled potatoes. It has this tightly packed, semi-crystalline structure that enzymes can't easily break down. And clinical studies actually show that adding both RS1 and RS2 into your diet actively lowers blood glucose levels and improves your overall insulin sensitivity. It's a hugely powerful natural dietary intervention. So when that resistant starch finally hits your colon, it acts like a massive all-you-can-eat buffet for your gut microbiome. This fermentation process produces short-chain fatty acids, primarily one called butyrate. And let me tell you, butyrate is an absolute miracle molecule for metabolic health. It enhances the integrity of your gut barrier, which drops systemic inflammation. Even more incredibly, butyrate stimulates the release of GLP-1. That's a hormone that slows gastric emptying and drastically improves insulin sensitivity. So by simply changing the structure of the starch you eat, you're cultivating a gut environment that actively fights insulin resistance from the inside out. All right, Section 3, exercise and intermittent fasting, focusing on timing and movement. Normally, insulin is what pushes glucose into your skeletal muscle. But here is a truly beautiful metabolic secret for you. Physical exercise bypasses the need for insulin entirely. Contracting your muscles triggers specialized transporters, called GLUT4 receptors, to move right to the cell surface and vacuum up glucose directly from the blood, totally independent of insulin. Fasting provides a parallel benefit by flipping a major metabolic switch. By depleting liver glycogen through fasting, your body cranks up a hormone called adiponectin. And adiponectin enhances fatty acid oxidation and dramatically improves insulin sensitivity across your muscle, liver, and adipose tissues. So how do we actually pull this off? Well, through structured fasting protocols. Time-restricted eating, like a 16-hour fast with an 8-hour eating window, or even just a gentler 12-hour overnight fast, gives your body a serious break from constant digestion. These fasting periods activate an enzyme called AMPK, which drops your triglycerides, lowers your resting insulin, and promotes cellular cleanup. Now, safety is absolutely paramount here, okay? While it's fantastic for type 2 diabetes and prediabetes management, fasting is strictly contraindicated if you have type 1 diabetes, if you're pregnant, or if you have a history of eating disorders. You've got to tailor any fasting style to your specific physiology. 5.8%. That is the seriously impressive HbA1c level achieved in a documented case study after 14 months of just a simple 16-hour daily intermittent fasting protocol. Now, HbA1c measures your average blood sugar over 3 months, and bringing it down to 5.8% is a phenomenal indicator of restored metabolic health. It just proves the profound power of simply changing when you eat, basically giving your pancreas a much-needed vacation.
On to Section 4, breathing for blood sugar, or what we call the nervous system shield.
Remember earlier when we talked about cortisol just slamming those cellular doors shut? Well, a consistent diaphragmatic breathing practice provides a literal metabolic shield against that stress-induced hyperglycemia. Activating your vagus nerve through specific breathing techniques literally halts that chemical stress cascade. It acts like a brake on your nervous system, signaling to your body that it is safe. And when you feel safe, your cortisol drops and your cells become willing to accept insulin and glucose again. You're quite literally building a metabolic shield with your breath. Actually, let's just put this into practice right now. Sit up straight with me. Put one hand on your belly. Okay, now inhale slowly through your nose and push your belly out into your hand. Your chest shouldn't move at all. Now exhale slowly, letting the belly fall. This slow-paced, diaphragmatic breathing gently raises carbon dioxide levels in your blood, which directly stimulates that vagus nerve. Studies actually show that combining this simple breathing exercise with your daily routine significantly lowers HbA1c levels in type 2 diabetes patients by reducing those crazy stress-induced glucose spikes. Which brings us to Section 5, your daily action plan, where we synthesize all these pillars together. By structurally integrating all these tools, you're creating this amazing, comprehensive lifestyle loop. Think about it. In the morning, you extend your overnight fasting window to keep your insulin low, and you pair it with 5 minutes of that diaphragmatic belly breathing we just did to set a calm, low cortisol baseline. As you move into the afternoon, you get in some moderate aerobic exercise, maybe just a brisk walk, to force those GLUT4 receptors to pull glucose right into your muscles, and then you break your fast. Finally, in the evening, your dinner incorporates lentils for RS1 or maybe a side of cold potato salad for RS2. This feeds your gut microbiome overnight, producing that amazing insulin-sensitizing butyrate right as you restart your fasting window. You know, it is just incredibly empowering to realize that you are not at the mercy of your metabolism. You are the architect of it. Every meal timing choice, every serving of resistant starch, and every slow, deep breath is a direct communication with your cells. I really hope this explainer has empowered you with the knowledge to take control of your health naturally. So, looking at these natural pillars, what small change are you going to make right now?